today we are looking at the differential diagnosis of trauma. Trauma and the stress related disorders. So under this, first we are going to look at the PTSD. PTSD is the post-traumatic stress disorder. So what is the stressor here? So the stressor, if you see, the stressor is nothing but there is extreme traumatic events. So there is stressors. There is extreme traumatic events. Extreme traumatic events such as the rape or accidents. Next we are going to look at is the time. Time is nothing but the symptoms they develop within 6 months. They develop within 6 months and they persist more than 1 month. They persist more than 1 month. They persist more than 1 month. Then what about the symptoms? The symptoms is that there is flashback and nightmares. There can be flashbacks as well as there can be presence of nightmares. So this was about the PTSD. Next we are going to look at the adjustment disorder. So the adjustment disorder, the stressors, if you see, it includes the financial illness. They can be the financial, there can be the illness as well as the relationship issues. So what is the time period of this? The time is the symptoms, it develops within 3 months. So it is less than 3 months. And so less than 3 months it develops and results in 6 months. So it resolves in 6 months, and this is if the stressor is eliminated. This is if stressor is eliminated. So what are the symptoms of this adjustment disorder? The symptom is that it is mostly depressive and there is anxiety. It is mostly depressive and there can be anxiety as well. Later we'll see this. Next we are going to see the bereavement. Bereavement is nothing but the stressor is death of a loved one. So death of loved one. This is bereavement. And what will be the time? The time is nothing but the symptoms develop within 2 months. So you can say the symptoms it develops within 2 months and resolve within 2 months. So it appears in 2 months and resolves within 2 months. And what about the symptoms? The symptom is that it is mostly depressive. So this was about the differential diagnosis of trauma and stress related disorders. To learn and grow daily like this, please do subscribe.